was supposed to join us earlier. Mr. Nambiar is now with us. Mr. Nambiar, we had Mr. P. Chidambaram on our show, who said that there should be no taxation on import of medical equipment from abroad. This is not the time to collect taxes. Why does the government want to tax in the times of a pandemic?
I think I was listening to Mr. Chidambaram entirely, the entire interview between you and him. The only thing which I feel that Mr. Chidambaram is not living in India anymore. Today, the country's problem is that not about the taxation on these equipments or these the oxygen. Today, the main thing which we are lacking is that we do not have these things available. Nobody is worried about the tax today. Today, you give me oxygen, I am ready to pay. Who is talking about the taxes today?
No, Mr. Nambiar, but it has to be affordable also, no? You're saying everybody is willing to pay. It's not like they're doing it out of a very happy heart.
Sanket,
this is their compulsion that they're willing to pay.
Sanket, the challenges of today is as follows. There is no hospital beds. The hospitals do not have oxygen. There is not enough remedies.
No, so importing oxygen is also a challenge.
Life-saving medicines. These are the challenges.
No, that is why we were importing. No, this is why we were importing. Because there was a challenge and a problem. There was a problem of oxygen. That's why we are importing oxygen concentrators. Now, if we were to tax those oxygen concentrators, you tell me how much sense does this make?
I am only saying that at least 5 of my friends who are importing these machines, they are not able to import that not because of a tax issues. It is taking so much of time. There is a supply side issue. The supply side issue, anybody who understands the basic economics, in 3 weeks' time, these cases have gone up to such a large number. So there is today's challenge in this country we are facing is the supply side issue, not the tax issue. But I am not saying that there should be taxes. I would be very happy in any such kind of a situation. There should be zero tax for everything.
Enough. That's exactly the point.
Yeah. But in the meantime, but today let us not deviate the complete issue. Today the country is facing a challenge of a supply side issue.
Mr. Nambiar, while I agree with what you're saying, the point is,
of people in Delhi ready to pay as much as money for a hospital bed. Will you be able to give them a hospital bed? That should be the question today.
That is also a question. This is also a question. Why should the government be taxing? And as if the government has done some sort of a favor reducing it from 28 to 12. Our question is, why this 12 also?
One question you asked Mr. Chidambaram, is there any earlier precedents which related to something like this? He was not able to. He was a former finance minister, one of the longest serving the minister in this country. He was not able to tell anything. So, but I am not saying that there should be taxes. There should not be any taxes.
Okay.
But let us not deviate the crisis.
Nobody is deviating. This is as much as an issue as is the crisis that we are presently.
Let's not make any state government and the central government as the villains. Everybody wanted to support the system, but then yes, we are in a crisis. The last time in the first wave, the peak was 93,000. Today we are standing on 4 lakhs.
Absolutely, which is why we need these oxygen concentrators more, which is why we need all this equipment more, and that too at affordable rates. As you must have heard, the doctors also, they are saying flood the markets. You cannot flood the markets and at the same time profit from it. That's the only limited point. Mr. Nambiar, I've run out of time, but thank you very much. Let's quickly move on to our discussion number 2.